Okay guys, Timmy coming at you again. Today what we're going to do is we're going to go over arterial blood gases. And I'm going to explain to you why it's important and how acid-base balance is controlled in the body. But first of all, what I'm going to do is I'm going to begin with the equation that you love to hate. And that is carbon dioxide plus water gives you carbonic acid. And carbonic acid breaks down into free-floating hydrogen ions and bicarbonate ions. And any substance that produces free-floating hydrogen ions is by definition an acid. Therefore, because CO2 does that, CO2 is an acid. Now, to understand how this equation works and why it's important, and to be perfectly frank, this is acid-base balance in the body. And I know that for many of you, you guys are in third semester and you're learning about acid-base balance and fluid and electrolytes. And if you would just embrace this equation, and it's not that hard, it's actually one of the simplest equations ever. If you follow this little program I'm trying to lay out for you, it'll make complete sense. Now, let's break it down a little bit for you. First of all, carbon dioxide is controlled by the respiratory system. And bicarbonate, which is a base, and acids and bases neutralize one another. So if you think of carbon dioxide as an acid, bicarbonate as a base, which of course it is, then it should start to make a little bit more sense. Now, because the respiratory system controls carbon dioxide and CO2 is an acid, if carbon dioxide or PCO2 goes up in the blood, that's going to lead to a decreased pH in the blood. So if somebody's not breathing so good, for whatever reason, who cares? If they're not breathing so good and their PCO2 is going to go up, that's going to drop the pH because CO2 is an acid. So the only system that can compensate for a respiratory acid-base imbalance is bicarbonate. And bicarbonate is controlled by the kidneys. So in this case, if the respiratory system isn't working so good, then what's the kidneys going to do? Well, remember, the functional unit of the kidney is the nephron. And the kidneys control bicarbonate levels. And bicarbonate can be filtered by the glomerulus and can get peed out. Hydrogen ions, on the other hand, have to be secreted from the blood into the urine. So if the respiratory system is causing the problem, meaning you're not breathing so good, so PCO2 is going up in the blood, and remember the goal of the body is to maintain pH, then the kidneys have to help out. So how the kidneys help out is they will take the bicarbonate that was going to get peed into the toilet and reabsorb it back into the blood. And they will secrete the hydrogen ions that were in the blood into the urine, and you will pee them out into the toilet. So if your PCO2 goes up, and that's controlled by the respiratory system, then in order to maintain pH balance, the kidneys have to reabsorb more bicarbonate. So if you are producing a respiratory acidosis because you're not blowing off the normal amount of carbon dioxide, the kidneys can help restore that pH by reabsorbing bicarbonate back into the blood. And that's exactly what happens. And this is important to note. The kidneys can correct any pH disturbance in the body if you live long enough. That is why physicians in the emergency room and the ICU will be screaming to make sure that blood flow is maintained to the kidney. That's how dopamine works. Dopamine in small doses increases blood flow to the kidney. That's why people who are in shock, regardless of the cause, will be placed on low-dose dopamine to make sure the blood flow to the kidney is preserved so that the kidneys can correct any pH imbalance. So another way of looking at it is like this, right? So you have your balance of carbon dioxide and bicarbonate. And remember, CO2 is an acid and bicarbonate's a base. So in order to maintain the pH of the blood, there has to be a balance there. So let's say, for example, that something causes the carbon dioxide in the blood, the arterial blood, to go up, right? In order to maintain the pH of the blood, the bicarbonate level has to go up, so these are balanced. And again, CO2 is controlled by the respiratory system. Bicarbonate is controlled by the kidneys. So if CO2 goes up because you're not breathing so well, that elevated CO2, that PCO2, tends to drop the pH, right? So that would be what is referred to as a respiratory acidosis. And the pH will begin to drop. So if the kidneys are going to help out in an attempt to maintain that pH between 7.35 and 7.45, what does the kidney have to do? The kidney has to increase the amount of bicarbonate in the blood. And again, how does it do that? The kidneys will reabsorb the bicarbonate back into the blood that was going to get peed into the toilet and then excrete those hydrogen ions. That's how the kidney compensates. Now, this is it shouldn't be more difficult, but I'm going to explain this. So, in metabolism, our cells making energy or doing the things that they do in order to survive, right? They make hydrogen ions. But if there's a condition that causes the cells of your body to make extra hydrogen ions, more than normal, through metabolism, and those hydrogen ions that are produced by the cells get dumped into the blood, there is bicarbonate circulating in the blood. And remember, the only thing that can affect the pH of the blood are free-floating hydrogen ions. If you have increased amounts of free-floating hydrogen ions in the blood, that will lead to a decrease in the pH of the blood. And that is called acidosis. And again, because the goal of the body is to maintain homeostasis, if the cells of the body are producing excess amounts of hydrogen ions and dumping them into the blood, bicarbonate, there it is, circulating in the blood, can grab them and lock them up so they're not free floating. If that's the case, that will drop your level of bicarbonate. You're essentially using up your bicarbonate if the cells are making extra hydrogen ions. So if you look at this, if your bicarbonate drops because the cells are making extra hydrogen ions and bicarbonate is getting used up in order to buffer them, That's what's referred to as a metabolic acidosis. And the only system that can compensate for a metabolic acidosis is the respiratory system. So here are the normal levels of PCO2 and bicarbonate. If the cells through metabolism start making extra hydrogen ions and dumping them into the blood, that's going to decrease your bicarbonate. But you want to maintain the pH of the blood. So what is the respiratory system going to do? The respiratory system, if it's compensating, is going to decrease PCO2. It's going to get rid of more CO2 than normal because CO2 is an acid. So if you're making acid at the level of the cell, you have to get rid of it at the level of the lungs. So again, the only system that can compensate for a metabolic acidosis is, of course, our buddy, our pal, the respiratory system. And I'm going to write that down, and I did. Only system that can compensate for a respiratory pH imbalance is the kidneys. And the kidneys help maintain the pH of the blood by either reabsorbing bicarbonate or excreting bicarbonate. And the only system that can compensate for a metabolic pH imbalance is the respiratory system. And the respiratory system controls carbon dioxide. So if you understand that the respiratory system controls carbon dioxide and the kidneys control bicarbonate, anytime you have an increase or decrease in PCO2 or bicarbonate, that should tell you what's potentially causing that pH disturbance. So let's look at this a little bit. Okay, so first thing you have to know is you have to know the normal values. So when you look at the pH, and again, these are arterial blood gases. And again, you don't draw arterial blood gases willy-nilly. These people are sick. So if a person comes in and they're really jacked up in the emergency room, they're going to draw these blood gases because they need some really good information as to what's going on with this patient. Or if the patient is in the ICU and they're in trouble, then arterial blood gases are going to be drawn. And because the pH is critical to maintaining the shape of those critical enzymes that control all the chemical reactions inside the cells of your body, then look what shows up first on a blood gas. Can't believe it. It's pH. And normal pH is 7.35 to 7.45. And anything less than 7.35 is by definition considered an acidosis. And anything greater than 7.45 is considered an alkalosis. So first thing you want to do is you want to look at the pH. Determine, is it acidic, basic, normal? Then the next thing you want to do is you want to look at your PO2, which is the amount of oxygen dissolved in the plasma of the blood. And because it's a pressure, it's measured as millimeters of mercury. And then you want to look at your O2 saturation, which is the amount of oxygen bound to the red blood cell, the iron and hemoglobin. And this is the best way to transport oxygen. And normally when that red blood cell leaves the lungs, 96 to 98% of all the irons in those hemoglobins should have an oxygen bound to it. Then you look at PCO2 and bicarbonate. And these really ultimately determine the pH of your blood. So you look at PO2 and O2 sat just to determine whether or not they need oxygen. You look at the PCO2 and the bicarbonate levels to determine if there is a pH imbalance, what's causing it. Is it the respiratory system or is it metabolic? So having said that, let's go through a couple and I'll show you. All right. So I'm going to give you one and then I'm going to explain how to attack it. See, I made a mistake already. Okay, so you're in the ICU or ER. Patient's in bad shape. Doctor orders arterial blood gases. You get the results back. These are the results. So the first thing you want to do is you want to look at the pH and determine whether it is acidic, basic, or normal. This pH is 7.17. So this is an acidosis. Then you look at the PO2 and the O2 sat. One of the things you should remember from our oxyhemoglobin dissociation curve is that when the pH drops, it shifts the curve to the right, meaning that for any given PO2, the amount of oxygen bound to the red blood cell is going to be less. So you're going to have a difficult time binding oxygen to the hemoglobin in the lungs. It'll let go when it gets to the cell. The problem is you can't bind it in the lungs. So O2 delivery to the cells is going to be decreased. Now you look at the PO2 and the O2 sat. The PO2 is low, O2 sat is low. So you give them oxygen. Then you look at the PCO2 and the bicarbonate. Let's look at the PCO2. The PCO2 is high. Normal is 35 to 45, so this is elevated. And anytime you increase PCO2, that is going to lead to a drop in pH. So we can conclude from this that this is a respiratory acidosis. The lungs are causing the problem. Now, what's the only system that can compensate for a respiratory problem? It is the kidneys, and the kidneys control bicarbonate. So if the kidneys were going to help out, how would they help out? Well, if you recall, they would take the bicarbonate that was going to get peed into the toilet and reabsorb it back into the blood and then pee out the extra hydrogens. So if the kidneys were helping out, the bicarbonate level should be higher than normal. So if you look, the bicarbonate level is normal. So the kidneys haven't caught on yet. So this is what's referred to as an uncompensated respiratory acidosis. Why is it uncompensated? Is because the kidneys haven't caught on yet. So the kidneys aren't doing anything about it. So what you want to do is you want to get respiratory therapy down, ventilate this guy, intubate him, put him on a ventilator, and see if you can get some more oxygen and get that CO2 off. All right? So let's try another one. So here, pH. Okay, so here we go. We have arterial blood gas. Look at the pH, 7.20. So we can conclude that this is an acidosis. Now you look at the PO2 and the O2 sat. Again, these are low, so you want to give them oxygen. Give them some O's, right? Now you look at the PCO2. PCO2, 35 to 45, 39, that's normal. So we know that the lungs are not doing anything. Now we look at the bicarbonate level. The bicarbonate level is low. So what's going on here? Well, remember that you have a cell. Who cares? And for whatever reason, these cells are making extra hydrogen ions and dumping them into the blood, right? So if those hydrogens get dumped into the blood, what's in your blood that could buffer them? That's right, our buddy, our pal, bicarbonate. So bicarbonate will bind those hydrogen ions and then lock them up in carbonic acid. And remember, the only thing that can affect the pH of the blood are free-floating hydrogen ions. So you've essentially locked those hydrogen ions up in carbonic acid, and you've decreased the amount of circulating free bicarbonate. So when the bicarbonate decreases, it decreases because some metabolic process is producing too many hydrogen ions. So this 7.20 pH is a metabolic acidosis. Now, what's the only system that can compensate for a metabolic pH disturbance? That's our buddy, the respiratory system. And how would the respiratory system compensate? If the bicarbonate drops because the cells of the body, through metabolism, metabolic acidosis, are making more hydrogen ions than normal, that will decrease the circulating level of bicarbonate, right? So to maintain the pH, your CO2 has to go down. And what system controls CO2? That's the respiratory system. So how do you get rid of more CO2? You breathe faster and deeper. So the only system, again, that can compensate for a metabolic pH imbalance is the respiratory system. So if you look at our blood gases, we determined it's a metabolic acidosis, right? And because the PCO2 is normal, the lungs have not caught on yet. So because the lungs haven't caught on yet and they haven't tried to help out, this is an uncompensated metabolic acidosis. Uncompensated metabolic acidosis. Why? We know the bicarbonate is low. And when bicarbonate is low, that leads to a drop in pH. And what's the only system that can compensate for a metabolic pH imbalance? In this case, a metabolic acidosis, is the respiratory system. All right, so let's try another one. Here we go, pH. And again, PO2 and PCO2 are pressures, so they're measured in millimeters of mercury. And bicarbonate is an electrolyte, so it's measured as milliequivalents per liter. Okay, so let's go through our steps. Look at the pH. What's the pH? It's acidic. So this is an acidosis. Look at the PO2 and the O2 sat. Yep, give them some oxygen. PCO2 is high. So elevated PCO2, right? And PCO2, CO2 is an acid, so if you have more acid, that's going to drop the pH. So we know that this is a respiratory acidosis. Now, what's the only system that can compensate for a respiratory acidosis? That is, of course, the kidneys. So how are the kidneys going to compensate for a respiratory acidosis? They are going to reabsorb bicarbonate back into the blood and secrete the hydrogen ions. So if the kidneys are helping out, what should happen to the amount of circulating bicarbonate in the blood? It should go up. Does your bicarbonate go up? Yes, it does. So you have an elevated bicarbonate. But your pH is still acidic. So even though the kidneys are helping out with this respiratory acidosis, it hasn't helped out completely. It's helped out partially because the pH is still acidic. So this is what's referred to as a partially compensated metabolic or respiratory acidosis.